I am so excited to introduce Greg and mPharma to the stage. For the last decade, I've worked with smallholder farmers. Farmers are the biggest group of poor people in the world, and after fertilizer, their second biggest expense each year is healthcare. And it's because they don't know how much the medicine will cost, they wait. So they fall ill, and they wait, and they wait, and they wait. And if they finally make it to a doctor, then it really is expensive because they've waited so long. And mPharma is solving this. They're making medicine accessible and affordable. They're making sure that pharmacies have stock and that families know how much the medicine should cost. This is so important. They're using data in a really thoughtful way to make supply chains reliable. And it's making sure that medicine gets to the people who need it the most. It's incredibly important. It affects millions of lives. And just to give you a personal example, in 2008, I moved to rural Kenya, to this really small town. Claim to fame was that it was the last truck stop before the Ugandan border. And I was so excited to start my job. And that first week, I fell really ill. I ended up getting malaria and pneumonia. For those of you who know me, if I do anything, I do it all the way. And because I was slightly delirious, my boss kindly offered to walk me down to the clinic. So we're walking down the dirt path, see the doctor, he does some tests, he handed the bill to my boss, and then they started to negotiate. And I'm not saying like a polite, we're a frequent customer, can you take 10% off? It was like a real in-the-market type of haggling. And I'm watching this going back and forth, and I'm thinking, oh my God, this is my life. I'm negotiating for medicine. Can you just imagine what it's like to be sick and anxious and worried and have to negotiate for life-saving drugs? This is the problem that Greg and the mPharma team is solving. And they're doing this across Africa, 250 clinics serving hundreds of thousands of patients each day. Let's see how they do it. Congratulations, Greg Rockson.
"11 years ago, I left Ghana to study at Westminster College in Fulton, Missouri. A few days after I arrived, Barack Obama was inaugurated as president. Bob Hansen, our Dean of Students, invited me to watch the inauguration ceremony with him and his family. But I slept through my alarm. In my shame, I sent an apology email. He replied immediately to let me know he was still on campus waiting for me. So I jumped out of bed, took my quickest shower ever, and ran to him with a second apology in hand. But before I could say anything, he stopped me and said something that has been a guiding principle in my life. He said, "I was never going to leave here without you. I do not give up on people." Sometimes a life appears broken, a challenge unsolvable, but our world is too beautiful for us to give up on our dreams for it. You have applauded today, but to be honest, I do not feel deserving of this honor. Not when millions of Africans have to make a daily choice between buying their insulin or providing food for their families, between paying to see a doctor or paying for their child to see a teacher. These should not be the choices people make in a just society. For me, and I'm sure it is for all of you, speaking about healthcare is deeply personal. Today, I remember my aunt, Mama Charity, who we lost to cervical cancer last year. I think of my dad, who's a survivor of prostate cancer, and my mom, who lives with diabetes. I hope that one day I can stand before you and truly deserve your applause and maybe another standing ovation. When mPharma ensures that every African is not denied access to high-quality medicine because of their socioeconomic background. We shall be a company that is built for its most important shareholders, our patients. Even though I stand here alone, there are many of us on this journey, including my co-founders, Dan and James, and over 150 incredible people in Ghana, Nigeria, Zambia, Kenya, and Zimbabwe. They are the best part of this journey, and this award belongs to them and all our partners who are working with us to build an Africa that is in good health. Thank you.